I was too young, too fit, didn't smoke, didn't drink, didn't do drugs. I couldn't speak, I couldn't read, I couldn't walk. Every day, I faced challenges with everything. A stroke took away so much of my confidence. I'd run off battery power, but I still had to run the family. These voices echo from younger women stroke survivors. My name is Dame Elizabeth with my supervisors, Dr. Michelle Honey and Dr. Julie Slark. I'd like to present our study entitled A Comprehensive Approach to Younger Women Stroke Recovery, the Mental Health Framework. Here are the outlines of our presentation: backgrounds, research questions, study basis and methods, findings, conclusion, and references. There are three key points that underline our study: global burden of stroke, stroke in women, and stroke rehabilitation. There was a significant morbidity and mortality of stroke. About 101 million people worldwide experiencing the effect of stroke annually, and an incidence of 12.2 million new cases. And the incidence of ischemic stroke in young adults aged 18 to 50 has risen by 23% over the past decade, especially among women. Stroke in women. Studies from Europe and US indicate higher stroke rates in young women than men, with stroke having a differential impact and also risk factors and outcomes. Unfortunately, women often report non-traditional symptoms, leading to misdiagnosis and worse outcomes. Despite advancement in acute stroke care, rehabilitation, especially in the community, tends to focus on or is more utilized by male patients. This poses a challenges in developing tailored stroke prevention and rehabilitation for women. This fact underscores significant problems and research gap. The rise of stroke in younger women, a lack of studies focusing on women, lack of awareness regarding unique risk factors, symptoms, outcomes, and impacts in women. In response to the research problem and existing gap, I formulated two research questions. I initiated by exploring their experiences with stroke and then delve into identifying their specific needs to overcome the challenges they face after stroke. These questions guided me in formulating a series of bases necessary to explore and gather as much information as possible to address this issue. I finally conducted 4 study phases to ensure an appropriate answer to the research question. Phase 1, I explore younger women stroke survivors' experience. Phase 2, I explore perspectives from healthcare professionals. Phase 3, I got back to younger women stroke survivors and then explore their preferences about stroke rehabilitation. And the last one, phase 4, I developed a stroke rehabilitation framework. I adopted framework development phase by RC and O'Malley, 2005, from identifying research questions and then continue to identifying relevant phases and then selecting relevant findings from phases and then organizing findings together and summarizing findings to framework. We can see the study phases from phase 1, phase 2, phase 3, and phase 4. Phase 1 of my study identified 4 main themes: the complex impact of stroke on women at younger age, the specific correlation with women's reproductive health, challenges in post-stroke self-management, and also the importance of internal and external support. This figure describes the current situation of younger women stroke survivors, with a large portion of the impact of stroke at the bottom of the pyramid, while the portion of support is the less experience. The hope is that the implication of this study will change the pyramid person in reverse order, making the impact of stroke less and the support greater. In phase 2, healthcare professionals highlighted 3 main themes in caring for younger women after stroke. And these 3 major themes can be visualized using the analogy of balance scale, where there are 3 points, 2 weights representing younger women stroke survivors issue and younger women stroke survivors support needs, and the ideas of stroke rehabilitation program would balance their life with lighter burden they have and enhance their recovery and better quality of life. In phase 3, younger women stroke survivors express a preference for a rehabilitation program that allows them to set personal goals and involve a supportive team approach. Ongoing support and empowerment, particularly tailored to their specific needs, and fostering collaboration among healthcare professionals. Based on the findings that reveal the experiences and the needs of younger women stroke survivors, the following key points were identified: monitoring, education, navigation, tools, and recovery program that abbreviated as mentor. The mentor was transformed into a graphical version. We can see from the first stage, identifying research question, and then stage 2, identifying relevant phases, phase 1, phase 2, and phase 3. In stage 3, selecting relevant findings. Stage 4, organizing findings together. And stage 5, summarizing findings to framework. The mentor concept was transferred into graphical version. All women who had previously participated were emailed and invited again to share their feedback. 5 younger women stroke survivors joined and interviewed. The interview lasting between 60 to 90 minutes. They identified 3 key areas for improvement in the framework: adopting a holistic approach, prioritizing a user-centered approach, and ensuring continuity in the program. The initial mentor program was online, and then it evolved into ongoing support in the mentor hub, reflecting the woman's feedback about the app and the difficulties in using such technology. So, in conclusion, what are the experiences of younger women stroke survivors? Poor stroke recognition and diagnosis, specific stroke risk factors for women, complex impacts of stroke, and what are the specific needs? Setting their own goals, holistic and team approach, continuity of support and care. Younger women stroke survivors face the complex and challenging impact of stroke. However, existing stroke rehabilitation had not yet addressed their specific needs, and there is a need for tailored support, personalized, interdisciplinary, and continuity of care. We can see these qualitative studies reveal younger women stroke survivors issue, identified gaps in rehabilitation programs, developed tailored stroke rehab framework, advocated research and policy initiatives, recommended holistic approach in clinical, and proposed educational initiatives. As implication for research, future research for stroke rehabilitation framework testing, co-design stroke rehabilitation program, and more extensive studies on this demographic. For policy level, public awareness strategies including prevention, recognition, and stroke management. For practice, the implementation of holistic and interdisciplinary approaches, and for education, how to increase awareness among the public, healthcare students, and professionals regarding the specific issue faced by younger women stroke survivors. These are my references. I'd like to close this presentation with an amazing and important quote from Rebecca Milner. If you check the health of a woman, you check the health of society. Thank you.